Good evening. I'll say from the beginning, I'm a doctor of philosophy, right? And I know about chemistry, right? I'm not a clinician. My background is mostly from the social services side of things in local authorities involved with social care, education, and running computers for those sort of systems. But my story is based on a sample of one going through dementia, which was my mother, right? So a lot of the anecdotes I will give are in fact from a very small case study. I'm looking upon Telecare about keeping people warm, making sure they're eating and they're drinking, and if they do fall over, as they inevitably will, that they're not left lying for days at a time. And I'm not going to go through these statistics. They're very well known, but as you know, they're going to apply to most of you in this room. 3/4 of you are likely to need some sort of care and support before the end of your life. And Vicky Sargent produced this document for Soccertim and ADAS, and can I recommend it for people to look at? There's 2.5 million over 75 living alone. This was a story, and I made a presentation. I wanted a volunteer to help me in a project. And this guy came forward and he said he's worried about his grandmother, and he gave the story about his grandmother, and over a period of a week what happened to her. He says the indicators that were important to him were the number of cups of tea she was having, what the room temperature was, and what time she woke up and got up. The key thing at the beginning, on the Sunday evening, the heating went off, and for about a week in the middle of winter there was very low temperature. So she got hypothermia, right, and she managed okay, and as typical old lady, she didn't want to bother anybody, but on this day she stopped drinking, right, got into a bad condition. When he rang up on the Sunday night, no response, had to knock the door down, taken into hospital, several weeks in hospital as a result of dehydration, malnutrition, and the fall. He said, if I'd have known on the Monday, none of this would have happened, right? So he's, in fact, the inspiration, right, about keeping warm, drinking, eating, and keeping mobile. Again, loads of figures here. The state costs are relatively high. They say, 8 or 9 billion. The cost of its unpaid care, which is far bigger than all the others. This is, 6 million unpaid carers, and it's a high cost to the economy. I'm talking about early stage dementia. It's an American website, so I don't know whether it applies in the UK, but it made sense to me. People recognise when people are getting old and their memory's going, they forget where they are, right? They're having problems keeping clean, right? And communicating with other people. And these 5 stages are mentioned now. What can you do in the early stages to help people, right, to live well as they're getting older? So the key thing here is that the person himself does not probably recognise as a problem, right? It's recognised by family, right, and clinicians. When it comes to referral to social care, only 25% are self-referrals. Most of the referrals come from other organisations, and it's just the same with dementia and the problems it can bring about living well. What I'm basing a lot of what I'm talking about is the activities of daily living and the well-being research. Down that side, the far side, these are the things that you generally have to do to live well. Right? I don't want to read them out, but the significant one to me was the ability to be flexible and cut your own toenails. The research done by the Institute of Aging, right, looked at thousands of cases, right, and how they declined over the years. So that's over a 10-year period, and the bottom isn't death, right? It's the ability to be able to do anything for yourself, right? And this curve here, right, is basically if you are unattended and you don't feel too well, you will have, right, a long and not too pleasant lifestyle. If you look after yourself, right, and I'll call it self-care, doing the shopping, walking around, right, and keeping healthy, right, you can do an awful lot to actually prolong your good living. Now, what I'm saying is, my company's called Comuri. At this point in time, if you recognise things are happening, right, you can start putting Telecare in to make sure, or to find out what people are doing, to encourage them to keep on the right-hand side of this, right? So rather than making a hot meal for somebody, make sure that they cook their own hot meal, and we're trying to drive people over this area. I'll come back to this curve later. At a certain point in time, expensive domiciliary or residential care, the product I've got, which is this box here, right, isn't going to be particularly useful, I don't think. So I'm echoing a lot of the things that Dr. Aurora said. Now, I've split the Telecare devices into active ones where somebody has to do something, such as pressing a pendant button or working with smartphones. A lot of money has been wasted on this because some people will actually refuse to be involved in the active devices. And we've got all the passive devices that again were mentioned, bed chair, sensors, power sensors, CCTV, dotted around the rooms. They're all good in specific purposes, but they're not for everybody. And again, I'm just echoing what everybody knows to be true. And really, it's about a people business. This has got sensors, right? We do some predictive analytics. What we do is work out what normally happens every hour of the day, and we're detecting changes, right, in patterns of behavior. So that's the prediction, show it on a smartphone. A family member, right, probably an unpaid carer, will look at things, keep contact with the payment. So it's the people cycle that's important. Technology is only part of it. Again, maybe lots of people know this, as most people do know this, I think, is when somebody are told, right, that there's a problem, you go into some sort of denial. A lot of people will continuously refuse to believe that they're getting older and they're not well, and you get an irrational belief that your well-being is good, when in fact, you know, as aging's going on, you've got to somehow accept a new normal level of behaviour. After the denial, you may get some depression, and some people may stay down here. Capacity goes down as you get older, and the stigma is important, which is important in terms of wearing wearing devices. And some people will just refuse to cooperate in any way, shape or form with what people are trying to do. So this is what it does. It measures the power of a kettle and a microwave, so we know they're eating and drinking. It measures the temperature in the room to help to avoid hypothermia. It's got a motion sensor, right? It has also got a radio transmitter, and if the power supply goes up, it's got battery backup, so it will report there's no power in the kitchen, right? And that can be, you know, a sign of poor well-being if people haven't got power. They may need it for medical purposes and all sorts of things. It doesn't require broadband, and it takes about 5 minutes to install. And most of all, to a lot of people, there's no change in lifestyle. You do what you normally do in the kitchen, and there's no interference. This is the data we're collecting, the raw data. It's a Manhattan chart. We're collecting motion, which is a yellow colour, red is temperature, green is spikes when the kettle microwave goes on, and there's the battery voltage. So we can do predictive analytics on this sort of data. So what we've got is in fact a daily well-being monitor So we can change the colour of the day. If everything goes as normal, as expectation, so every hour is in with the normal limits, right, we'll get a green day. This here, Sunday, a lot of changes. We turn it blue, not red, because that might have been the best day of the week. It might have been the day when they've gone out with the family, seen the grandchildren. Yes, there's been a lot of change, but it's actually a good day. We're not setting alarms, we're informing family members of changes, and that's what it is. There's a few changes, so Friday there, we've turned yellow. They might have actually gone out to a bingo night, which they maybe haven't done for several months. But we're doing hourly monitoring, right, of what's going on of an older person living alone. It's not necessary. If you've got a couple living alone, they can look after each other, and a lot of the problems are avoided if you've got regular visitors. But not everybody has got that. We can drill down to the details of the individual sensor readings. In this particular case, in the middle is the kettle, right? So the kettle is boiled an hour later. Well, so what? It doesn't really matter. One of the problems with a lot of the active devices is false alarms. We want to avoid false alarms because it destroys the reputation of what's going on. But this allows you to see what is going on, drilling down to the detail. And people are asking about cost. These are the Newcastle University figures based on a norm which will go a line somewhere down here. If you get early intervention, they reckon it saves £1,900 a year. So there's a cost saving on early intervention. If you don't do early intervention, it will cost you an extra £15,000 a year. Right? And if you look at these ADL monitoring, right, you can do questionnaires of the people in this area to be able to decide what sort of telecare is most appropriate for that person, right, depending on how their capacity is. And that's me finished. There are my contact details and questions.